The Joint Commission has made several patient safety goals, and as a clinical nurse specialist, you may work in a facility that is under the accreditation of the Joint Commission and must adhere to these rules. But even those in other practice could use these goals as a standard in their practice to decrease the risk of injury to their patients. These should have strategies to adhere to these goals and educate the staff and also monitor for compliance. Some of the goals that have been set are identifying patients correctly, improving effective communication, removing concentrated electrolytes from the nursing units, a checklist prior to beginning surgery, decreasing falls, and also complying with proper hand washing technique. When discussing identifying patients correctly, anytime that there is contact with a patient, their identification should be confirmed. Patients should have an armband placed on them with a unique patient identifier. And especially when administering medications, blood products, or performing tests such as lab work or any type of test, 2 patient identifiers should be checked, including the patient's name, looking at their armband, and asking it could be as simple as asking the patient to identify if their birthday, or you can look and match their medical record number to the medical record number on their armband. Another goal is to improve effective communication, and this deals mostly with physicians' orders. When they give verbal or telephone orders, staff should read back the order in some fashion to verify that what they heard is what the physician said. The physician should at that time confirm, verifying the order is correct. There should be some type of system in place noting that the order was, verbal or telephone order, and that it was read back and verified. Removing concentrated electrolytes is another patient safety goal. Electrolytes can be deadly when given in an incorrect form, such as a concentrated dose of potassium. And so it is a goal to not have that available easily, so that an accidental dose of an electrolyte such as potassium can be given. Another patient safety goal is a checklist beginning prior to surgery. Prior to the patient going to surgery, there should be a checklist done to ensure that the proper documentation is available with the patient on the chart, such as the proper consent and that it's signed and is correct, and that the patient's, sometimes facilities require that the history and physical be available on the chart. Any lab work that is necessary or any other test results should be available. Also, there should be a marking of the surgical site if there are multiple sites available, such as a left arm or right arm, and the patient should be a part of that if they are at all possible, to verify that what you're marking, or let them mark in some fashion that the site is correct. And just prior to beginning the surgery, there should be a process in place to have some sort of timeout procedure where the entire surgical team stops and verifies that they have the right patient in the right surgery in the right surgical site, and that all of the needed equipment or implants are available, and that if there is any allergies or medical concerns, those should be noted at that time. Another safety goal is to decrease falls in a facility. There should be some type of procedure in place to assess the risk of fall or fall risk in patients and identify those patients at high risk and steps be taken to prevent this. Also, compliance with proper hand washing technique is another patient safety goal, and it should be monitored and made known to the patients that it is important that healthcare providers do wash their hands and use proper technique when washing their hands after any patient contact.